Pen-Kera Cream is used to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin, reducing itching and flaking. Some ingredients like zinc oxide and white petrolatum help protect the skin from irritation. Dry skin is caused by a loss of water in the upper layer of the skin. Emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone, while humectants draw water into the outer layer of skin. Pen-Kera Cream also contains ingredients that soften the top layer of skin cells, helping the dead skin cells to fall off and leaving the skin feeling smoother and softer. It is recommended to use it as directed by your doctor or as indicated on the product packaging. Make sure to use this Pen-Kera Cream as directed. Some products may need to be shaken before use, so be sure to check the label. Apply the cream to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. For dry hands, you may need to use the cream every time you wash your hands, throughout the day. If you're using this cream for diaper rash, make sure to clean the diaper area well before applying the cream. And if you're using it for radiation skin burns, check with radiation personnel to see if it can be applied before therapy. Remember to follow all the directions on the label for proper use and only apply to the skin. Avoid sensitive areas like your eyes, mouth/nose, and vaginal/groin area unless directed otherwise by the label or your doctor. Make sure to consult your doctor or pharmacist for more details. For best results, use this cream regularly and after bathing/showering while the skin is still damp. If your skin is very dry, your doctor may advise you to soak the area before using the cream. And if your condition doesn't improve or gets worse, be sure to seek medical help right away. Using Pen-Kera Cream is generally safe and effective, but some people may experience burning, stinging, redness, or irritation. If these effects last or worsen, it's important to let your doctor or pharmacist know. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential risks. Most people using this cream do not experience serious side effects. However, it's important to contact your doctor right away if you notice any unusual changes in the skin, signs of skin infection, or if you have a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. Remember, this is not a complete list of possible side effects, so if you notice any other effects, be sure to talk to your doctor or pharmacist about it. As for the daily dosage and optimal timing, follow your doctor's instructions. And if you have any concerns or questions, don't hesitate to reach out to your healthcare provider. Before using Pen-Kera Cream, make sure to inform your doctor or pharmacist about any allergies you have to the ingredients in the product. If you have any skin cuts, infections, or sores, be sure to consult your doctor or pharmacist before using this product. Some ingredients in the cream, such as preservatives and fragrance, may make your skin more sensitive to the sun. Be sure to check the label for any warnings, and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, contact your doctor right away. If you have acne-prone skin, look for the word non-comedogenic on the label to avoid products that may worsen acne. Some products may also stain or discolor clothing, so consult your doctor or pharmacist for more details. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, be sure to inform your doctor before using Pen-Kera Cream. It is also important to consult your doctor before breastfeeding, especially if you are applying this product to the breast area. When using Pen-Kera Cream, it is important to be aware of potential drug interactions that may affect its effectiveness or cause serious side effects. It is recommended to keep a list of all the medications and products you are using, including prescription and non-prescription drugs, as well as herbal products, and to share this list with your doctor and pharmacist. It is crucial to always consult your doctor before starting, stopping, or changing the dosage of any medications while using Pen-Kera Cream. This will ensure the safe and effective use of the cream. If swallowed, Pen-Kera Cream can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of overdose, it's important to seek immediate medical help. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Always keep this medication out of reach of children. Remember to use Pen-Kera Cream only as directed by your healthcare professional. To prevent dry skin, it's important to use lukewarm water when bathing, take baths or showers less often, like every 1 to 2 days, keep baths or showers short, and use a humidifier when the air is very dry. There are various emollient products available in different forms such as oils, creams, lotions, or sprays. Some may contain fragrance or other ingredients that some people may be sensitive to. It's best to consult with your doctor or pharmacist to find the product that may be best for you. If you forget to use Pen-Kera Cream on your regular schedule, use it as soon as you remember. However, do not use extra cream or use it more frequently than directed to make up for the missed dose. Make sure to follow the storage instructions printed on the package, and if you have any questions, don't hesitate to ask your pharmacist. It's important to keep all medications out of reach of children and pets. Avoid storing the foam canister near high heat or open flame, and never puncture or burn the canister due to the pressure inside. When you no longer need the product or it has expired, make sure to properly dispose of it. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.